Hi everyone, my name is Kayla. I have a Bachelor of Health Science Naturopathy and I'm a naturopathic Kayla Nurturing Naturopath. Welcome to my podcast Awareness, where I talk about different awareness days, weeks, and months. And today is World Leprosy Day, and I have Eva Lee joining me, International Program Officer for the Leprosy Mission Australia. She's a speech pathologist and ADDC Executive Committee member. She holds a dual Masters of Public Health and Health Management and a Bachelor of Applied Science Speech Pathology, and she's currently completing her Masters of Disaster Design and Development. Hi, Leva, how are you?
Yeah, good. Thank you. Thanks for having me today.
No worries. Thank you so much for joining me. So, just from the start, what is leprosy or Hansen's disease?
Yeah, so leprosy is actually a bacterial disease that affects the nerves as well as affects the skin and your sensations as well. So it is a bacteria that's quite slow growing. So it takes a few days, or it takes at least, I think, 13 to 14 days for the bacteria to replicate, which is actually really slow when you compare it to, say, something like E. coli, which
Which
causes food
cause?
poisoning. Yeah, which replicates every 20 minutes or so forth. And so leprosy is a disease that has been around for many, many years now. If you look at records, previous records, say with the Christian Bible and so forth, it's been mentioned almost 2,000 years ago as a disease that was around then. And it's still around today. It is classified as a neglected tropical disease, occurring mostly in developing countries where sanitation and hygiene and health may be poorer. And so it is in these communities where leprosy often exists and is endemic in some of these places. So leprosy actually causes, in advanced stages, if it's not treated, it can cause nerve damage, which is irreparable. So you can lose sensation in your fingers, in your legs, in your eyelids, all over your face as well. And losing sensation actually causes a lot of problems for people. We don't realize it sometimes. We sometimes take it for granted that we can feel things. But when we lose sensations, we might not realize when there's a rock rubbing against our leg or rubbing against our foot, and then it can cause wounds. And these wounds, they won't feel painful for the people suffering from them, and they can cause ulcers as well. And so they can get infected, and with infections and so forth, there can be lots of problems for the body. And some of the other things that happens with leprosy is that it can cause weakness in your muscles. So that could be weakness in your arms, in your legs, but also in your face as well. So sometimes people might have difficulty closing their eyes because their eyelids they're not strong enough to close their eyelids because of those muscle weaknesses. And over time, as they lose sensation and there's nerve damage, sometimes your fingers and your toes, they can reabsorb back into the body. And so there is a bit of a myth going around that people think that leprosy causes your fingers and toes to fall off. But the honest truth is they haven't fallen off. The body has simply started to reabsorb them back into the body. So you do lose those fingers and toes as well. Yes.
Thank you.
So that's sort of briefly what leprosy is.
So it is rare in Australia, but it can be found mainly in Aboriginal and Torres Strait Islander people from Northern Australia. Do we know why this is?
Yes. So in Australia, we don't really have leprosy. So our statistics, I think, from last year says that we had maybe approximately 13 cases, and most of these cases are imported, so they've migrated here. It does happen more frequently in the top end of Australia, and that's because there are cases of leprosy in Timor-Leste and in Papua New Guinea, who are our neighbours up that way, up the north. And so often they may travel to Australia and they may have contracted it in their countries and then started to show symptoms here. And because it happens more up in those top areas, they visit more in those areas, then it looks like they have it more in those communities.
Right.
Mm.
And there's different forms of it, isn't there?
Yes, so there are different forms in terms of how it can present. The main bacteria, though, is Mycobacterium lepra that causes leprosy. But we do split it, or we do sort of divide it into two different types of leprosy. One is porcibacillary leprosy, or multibacillary leprosy. And so the difference between the two of them is that the bacilli one is there's a less load of bacteria being found in the body. So this might present clinically or through observation as only having 2 to 5 like skin patches or lesions on the skin. And if a person is found to have 6 or more patches on the skin, then we might classify that as multibacilli or MB for short, type of leprosy. And the reason why they classify it differently is because the duration of treatment will be different. So with the porcibacilli or the PB version, they recommend treatment for 6 months, and the MB is usually 12 months. So that's sort of the difference between them.
Oh, there you go. Thank you. And you were saying the cases are mainly in the socio-economic areas overseas. Is that correct?
Yes, and they often occur in these places because leprosy is quite interesting in how it transmits and how people do catch it. So leprosy, we suspect, is transmitted through air droplets, but also the bacteria can live in the environment for a little while. So it often occurs in places where hygiene or sanitation may be poorer because the bacteria can lie around for a bit longer. But one of the things about leprosy is also that if you contract it, not everyone will show symptoms of it. It actually depends on your immune system. So it does target you if your immune system is low. And so that's where symptoms may occur. And so that's why often it can occur in places where there are poorer living conditions. So in some of the poorer communities, because people might have poorer health in general, and they live in closer quarters as well. But another interesting thing about leprosy is it's actually not very easy to contract it. If I shake hands with somebody who has leprosy or give them a hug, it won't transmit, I won't get the disease, I won't get leprosy. But if I you have to live in close contact with them, say for at least 30 days or so forth, in order to be at risk of catching leprosy.
Okay.
And that's because the bacteria is very slow growing in that sense. And I guess as well with leprosy, in some of those areas where it is endemic, it is being passed through family members a lot of the time. And also because there is not a lot of education in some ways around how to detect leprosy, because it is seen as a disease that's often been wiped out in a lot of places. In a lot of the medical journals or for doctors, they often don't get trained in how to look for leprosy. And so because of that, people might live with it for quite a while, which then means that they're transmitting it to other people.
And so it would be if you are immunocompromised, you'd be more at risk of getting that, wouldn't you? Your immune system's low.
Correct. Yes. If
And
you are.
in those countries, are they sort of like excluded because of the leprosy, even though you said you can't get it through like holding hands or giving someone a hug? Is it sort of seen, as a bad sort of thing, and don't go near those people, don't touch those people, sort of thing?
Yeah, absolutely. So you've got that right. Yeah, so often people are discriminated against and separated and isolated from their families because leprosy is seen as a really devastating disease that has a lot of stigma surrounding it. So we know that it's not true that leprosy is really hard to contract, but in some of these countries, there's not a lot of education around leprosy, and so there's a lot of fear around what this disease can do, particularly because people might have heard it from generations ago and heard how horrific it was back in the time when we didn't have treatment for it, and so then that carries on through generations. And often as well, people or some countries actually still have some laws that discriminate against people with leprosy. So in some countries, there are laws to say that if you have leprosy, it is a reason for getting a divorce. Or it can be also a reason for why you cannot sit on the board of a university. If you have leprosy, or in some cases we've heard that there are communities where you're not allowed to ride on public transport. So often these laws were created years ago where leprosy was a big concern back then, but they've been left over as laws that keep continuing to exist. And so discrimination can occur for a lot of people. We have heard of cases of people who their families might are so fearful of leprosy that they sort of abandon them, or they put them in the goat shed or the cow shed, and told them to fend for themselves because they're just so afraid of catching it themselves. So definitely discrimination is still a really big issue around leprosy.
That's really sad, and hopefully, knowledge is power. So once, it gets out there more and people understand it more, they'll be more, kind and caring and understanding.
Yeah, I hope so. And so I think that's part of why as well we do a lot of education. So we do a lot of education in these countries, say in India, in Nepal, in some of the African nations as well, to educate those communities about actually leprosy is not a really big problem now. It is still around, but it can be treated and we can cure it. And if we catch it early enough, people don't have to be disabled from it. So yeah, so knowledge is definitely power.
Yeah, very important. And so, like you said, with the diagnosis, sometimes it can go undiagnosed, and it all sort of depends on the symptoms and stuff, doesn't it?
Yes, yeah. So it can be undiagnosed for a long time because often the first symptoms of leprosy is lighter skin patches. And as we know, there's a lot of other viruses or bacteria or diseases out there that can cause lighter skin patches. And so people aren't too concerned at the time when they see that. And one of the other things about leprosy is because it causes nerve damage and people don't feel pain, pain is often an indicator for us that there is a serious problem with our bodies. And because people don't feel pain, they think that everything's still fine and they're okay to continue surviving or existing or doing their daily routine. But often they don't realize is that when they don't feel pain, they are still getting ulcers and infections and wounds. And just because it doesn't hurt, it doesn't mean those are not getting more serious. And so often people might not seek out treatment until very late stages where they're struggling to walk, or they're finding a lot of weakness, or they're starting to lose mobility in their fingers or their toes. And that's when they seek treatment. And so often when it comes to those late stages, the treatment can prevent further damage, but unfortunately it can't reverse damage that's already been done.
Makes sense. So like you were saying, the main symptoms are the lighter skin, the nerve damage, the muscle weakness. Are there any other symptoms symptoms that come along, or is it just very dependent on the individual?
So those are the main things that people will look for. Sometimes there will also be nodules, so little lumps of skin, or little lumps on the skin, I should say. And often that might occur around the ears most frequently, but it can occur on the face as well. And so people who are diagnosed, or people who are experts in looking for leprosy, will look for these signs and symptoms to tell them if that's the case.
And so treatment, like you said, that needs to sort of be done earlier because it can't stop it from sort of getting worse, but it can't sort of reverse it either. Is that correct?
Yes, so treatment, the earlier a patient receives treatment, the better. So if we are able to catch the cases early, then often they can be cured without having a disability of any sort, and can just go on with life like normal afterwards. But it is the late stage cases where that damage can be irreversible. So the treatment that they currently have for leprosy is something called multi-drug therapy, or MDT, and it's actually a combination of 3 antibiotics. And so each of these antibiotics, if used by themselves, can cause drug resistance, which is why they need to be used in combination to make sure that patients don't develop resistance to any of these drugs. And so these drugs often have to be taken for a course of at least 6 to 12 months, but it can be more if the patient has more of a higher bacterial load in their body. But it actually needs to be taken for the whole time. And so if we think about, say, in Australia, when the doctor prescribes us antibiotics, and it might be they tell us to take it for 2 weeks. Sometimes we might struggle to even take it for the full 2 weeks because we see that our symptoms have cleared up, and then we might stop. And so it can be similar for patients with leprosy. Taking medication for 12 months with a dose each day can be a really long time. And so they have to be motivated and encouraged to stick with that course, because if not, if they stop halfway through, leprosy can come back and they can get reoccurrence from that.
So if it does come back, is it sort of worse than how they had it, or it just sort of depends?
It really does depend on each patient. Some patients will have it worse than before, and other patients may if in their first treatment they are close to finishing, it could be that it doesn't come back as severely. But for some, often it's actually a continuation of that of the damage that's being done from the previous round. So by taking the drugs, it actually is about decreasing the amount of bacteria in the body. So the bacteria is still there even as you discontinue before the end of your treatment. And so that bacteria can still continue to cause damage in the body. And so in some instances, it looks like it's worse, but it's actually just the disease is continually still in your body. There is one other thing about leprosy, is that often some patients may get reactions. So they're classified as leprosy reactions, and this can occur like before treatment, during treatment, or even after treatment. And these reactions occur when the white blood cells in the body suddenly sort of wake up and go, oh, there's this new foreign body this is bacteria in my body, and I need to go and target it and destroy it. And so then what it causes is the reactions cause inflammation all over the body. So it can be on the skin, in the eyes, in the ears, in the mouth, everywhere. And inflammation is really painful as well, this inflammation for patients. So in really severe cases, patients will feel so much pain that even simple things, like we've heard cases where simple things like getting blood drawn is actually really painful and agonizing for these patients because of that.
That sounds really painful.
Mm.
So that's one of the complications. Would the others be like the weakness and the nerve damage, like you said, them not being able to feel pain. So if they're doing something that's painful, they'll just sort of keep going and not know, that they're doing that further damage. Is there any other sort of complications?
Yeah, so I guess other complications can be to do with like wounds and ulcers. So often patients are more susceptible and prone to getting ulcers and on their feet or on their hands because whereas we lose sensation, we also don't sweat in those areas as
Yes.
well. And so they can often have severe ulcers. And if they're left untreated, they can become very infected to the point that the foot or the arm would need to be amputated, unfortunately. So it can get to those really severe levels. Another complication is that sometimes with the weakness that happens, it can cause a foot drop, or it can cause the hand to take on a bit of a clawed look to it. And so that limits mobility in the hands and the feet. Fortunately, it can be treated or it can be cured with surgery, but that skill of how to do that surgery is also very specialized. So not every country knows how to fix a clawed hand or a foot drop in leprosy patients any longer. But fortunately, in some of the areas where leprosy is still endemic, there are surgeons who is able to do those surgeries for them. Any other complications? Oh, yes. I guess also with the treatments themselves as well. Sometimes with the leprosy reaction treatment medication, the medication we currently have are two different types. One of them is penicillin and the other is thalidomide. So penicillin is actually a really common drug that even doctors will prescribe, say here in Australia, to treat asthma or for skin allergies. But it is a drug that should only be taken for a short while because if it's taken for too long, it can cause long-term effects of, say, brittle bone and blindness or high blood pressure and so forth. And unfortunately, our leprosy patients who do experience reactions do need to take it for quite some time. It could be anywhere from 6 months to a year or more for this drug. And so because of that, they can sometimes develop these long-term conditions associated with taking those drugs. The other drug that they use to treat reactions is something called thalidomide. For some people, they may have heard this name before. It was a drug that was developed, I think, back in the 1950s or 60s as an anti-nausea medication that was often taken by women for morning sickness or pregnant women for morning sickness. And it was discovered that it caused really significant birth defects. And so at the time, the drug was then banned from a lot of countries. But thalidomide we found was really effective to target leprosy reactions. But unfortunately, because it's banned in so many countries, you aren't allowed to take it outside of the hospital. And then that can cause problems as well for people as they have to stay in hospital for maybe a year in order to take that treatment. But also in other countries, they might actually not be able to access that drug at all.
That's very interesting. Was there anything you wanted to recap on or talk about that we didn't talk about yet?
No, I think we've sort of covered most of those things. I think a good thing to note about leprosy is, yes, it is a curable disease, and so a lot of leprosy organizations are working towards like eliminating and eradicating it, and so wiping it out completely. And there are signs that we are getting close to that. So I think every year we have approximately 200,000 new cases now each year, but that has been a big drop from previous years, where, back in, I think, the 1980s or so forth, it must have been in the millions and things like that. And so because we are getting close, there is a bit of a global strategy of how to work towards eliminating this. And so we call that the 000 strategy, which is zero transmission, zero disability, and zero discrimination. So there is a really ambitious goal to have zero leprosy transmission by 2035. And so that's stopping all transmission cases, hopefully by then. And so, yes, so we are working towards these three main points in trying to sort of eradicate leprosy completely.
Awesome. Hopefully that does happen. That would be really good.
Yeah, it'd be amazing to see if it could.
Well, for further information and or to donate, should people go to the Leprosy Mission Australia?
Yes, they can. There is a lot of information on our website about leprosy, as well as what's being done in the world in different countries to target or to combat leprosy. So if people would like to read some of that or to donate, if they wish, they can definitely go to the Leprosy Mission Australia website.
Awesome. Thank you. Well, thank you so much for joining me today and making us more of leprosy. I really appreciate it.
No problem. Thank you so much for having me, Kayla.
Thank you. Thanks everyone for listening.